In this video, we'll talk about shingles. Now, the causative agent over here is herpes zoster. So, there is a lot of confusion among students as to how is it herpes zoster. Now, there is varicella zoster virus. All right. Now, what we see is that the varicella, it causes chickenpox, and the zoster, it causes shingles. All right. Now, what is actually shingles? Now, what happens is after an initial infection, varicella zoster virus, it persists in latent form in the dorsal root ganglion, okay, of the sensory nerves. Now, when there is a stimuli to it, like stress, it reactivates and causes shingles. Okay, reactivates and causes shingles. Now, what I want you to get cleared of it is that shingles is never a primary infection manifestation, never a primary infection manifestation. All right, I want you to know that it is caused due to, it is a primarily caused due to reactivation. All right. Now let's talk about the epidemiology. Now it usually occurs after the age of 30 years, and it is mainly seen in people who have chickenpox or have had chickenpox. Now the mode of transmission is basically direct contact with open sores of shingles rash, or it can be airborne transmission. All right. The incubation period is 10 to 21 days. Now let's talk about the pathophysiology. How does shingle actually occur? So what happens is the varicella zoster virus, it enters the respiratory tract, which leads to the viral replication in regional lymph nodes, causing the primary viremia. Now this virus, it travels and it reaches to liver and spleen, where it replicates again and then causes secondary viremia. Now this secondary viremia, it enters into the nerve endings, enters into dorsal root ganglion of sensory nerves. Then after like a lot of time, it undergoes reactivation, and then it causes the infection of nerves and dermatome, ultimately leading to shingles. Now I will draw a diagram through which you will probably better understand what I was explaining in the introduction part. So suppose this is our spinal cord or the ganglion, right? Right, and this is our person. I mean, I definitely did not intend to make the head so big. It literally looks like hydrocephalus, but excuse me. So now, what will happen is, now if the infection is spreading, like suppose there's this sensory nerve, right? Let me change the color. So, like this is the sensory nerve, and this is the dorsal root ganglion. Now, if it is spreading like this, it is going to be chickenpox. All right. Now, this virus has reached the ganglion. Now, if this virus remains in the ganglion for a longer period of time, and our person looks like he's had hydrocephalus, but he doesn't have, you can draw better, obviously. Let's give him some eyes. I think I made it more worse. I made it into a girl. I think I can make this one better. Some anime, right? Okay, so yeah. Now this girl, she has got stressed. Now due to this stress, there is reactivation. Now it is going to act as a stimuli, and eventually the sensory nerve will act as the pathway for the reactivated virus traveling back. Now it is going back, so it is basically shingles. Okay. I hope I made it easier, right? This will cause chickenpox. This will cause what we call as shingles because it is going from the dorsal root ganglia. The virus was in a latent form and it just got activated, and now it is going to cause the clinical features of shingles. Now, what are the clinical features? Initially, what we see is there is going to be pain, dysthesia, also tingling. Then we will see that there occurs vesicles, papules, bullous lesions. Then there is a tendency that it can cause chicken pox on distant sites. Now the rashes, they appear on one side of trunk. They can also start appearing on the face, near eyes, ear, or nose. Alright, now let's talk about the complications. Now, to remember the complications, you can remember Poor's BCG. Now, you know that tuberculosis is a disease which usually I'm saying occurs in poor people. So, BCG is the vaccine which is given for tuberculosis. Now, you would be wondering why did I include tuberculosis in shingles? Just to make you remember this thing. Okay, just remember there's some poor person and he's got tuberculosis and he needs BCG. So, we just labeled it as post BCG. Now, by P, what you have is post herpetic neuralgia. Now, what is post-herpetic neuralgia? Now, in post-herpetic neuralgia, what happens is when it starts when it invades the, suppose this is the person, but I don't know why do I make the head so long, bigger. So, I am sure you must be knowing that the trigeminal nerve has three divisions: ophthalmic, mandibular, and maxillary. So, the nerve which is affecting this ophthalmic division. Now, this is basically post-herpetic neuralgia. It affects the ophthalmic division of trigeminal nerve, due to which there is formation of vesicles on cornea, which leads to ulceration and which can lead to blindness. Okay, now by the other O we have ophthalmic shingles. Now to a part of sadness, there's nothing from the next O, so we'll just skip it and we will jump to R. Ramsay Hunt syndrome. Now, I'm quite sure you must have heard that Justin Bieber got Ramsay Hunt syndrome. He got diagnosed with it. Now, what is Ramsay Hunt syndrome? Basically, you also call it as herpes zoster oticles. Now, by the name oticles, you must have come to know that it is going to be related to the ear. So, what we see is that it actually starts affecting the geniculate ganglion, which leads to the ipsilateral loss. I clearly don't know how to make it visible. Um, I'll just I'll just speak it. Ipsilateral loss of taste and buccal ulceration. Also, what you will see is rash in extra, uh, sorry, external auditory canal. It's being so extra auditory canal. So yeah, by B, what you have is the bowel and bladder dysfunction. Then by C, you have cranial nerve palsy. By G, we have granulomatous, oh God, granulomatous cerebral meningitis. Okay, now let's talk about the investigation. Now, in investigation, first of all, we can actually see it by the varicella zoster virus DNA. Then we can also see it through the anti-varicella zoster virus antibodies in the CSF. Then there can be detection of the DNA in the tissue. Then we do Zank smear, and we see that there are the characteristic multinucleated giant cells. Then ELISpot test. All right. In management, um, the management part, first of all, we will give a soothing solution or a soothing cream as in calamine. Then we will put on antiseptic powder because we don't want the infection to spread, any secondary infection. We just want to prevent it, right? Then we will, in old patients, what we do is we give, or also in immunosuppressive patients, we give idoxuridine. Yes, idoxuridine in 5% DMSO or 25% in DMSO. I for edoxuridine and I for immunosuppressive. Okay. Then what we do is we give them acyclovir 800 milligrams, then 5 times a day for 7 days. Okay. Then famiclovir is also famciclovir is also given 500 milligram. Now you can also give steroids, okay, like prednisolone. Now, yeah. Now, what is the thing is, if a person has post-herpetic neuralgia, right? So the person is going to experience a lot of pain. So due to that, we will give them post-operative post-herpetic neuralgia. So we will give them analgesics. So amitriptyline, pregnabilin, gabapentin, capsaicin, capsaicin. All right. Now, in amitriptyline, you can give 25 to 100 milligrams per day. Now, the pregabalin, it is basically 75 milligrams twice a day, which is built up to 100 milligrams or 200 milligrams 3 times a day, if it is tolerated. Then gabapentin is given in the dosage of 300 milligram per day, but it is built up to 300 milligram twice a day. Okay. Then capsaicin, it is basically given in the concentration of the, it is a cream which is used in concentration of this. Now in prophylaxis, we can actually give the zoster immunoglobulin to the non-vaccinated people and the pregnant mothers who are not vaccinated, also in immunocompromised patients. So this is what all makes up the shingles. I explained it in a very easy format and I hope you understood. Also, my drawing sucks, but I know you might have understood. I just don't remember where I wrote it. Yeah. So yes. So thanks for watching, and if you like the video, just boost the algorithm up by liking, commenting, sharing, and yeah, and subscribing to my channel. Thanks for watching.